Hi there, my name is Liz Childs. I'm a pelvic health physiotherapist and I'm going to be talking to you about pelvic floor exercises. So the pelvic floor muscles are really important muscles, but unfortunately they're in a bit of an awkward place. You can't see them and so they get forgotten about. And yet we know that if these muscles are functioning really well, you can help prevent some of the problems that we see. And also, if you do already have problems, then strengthening up the pelvic floor is an important part of your treatment. So pelvic floor problems are really common. 1 in 3 women who've ever had a baby have bladder leakage, and up to 60% of pregnant women leak urine. We know that 50% of women have pelvic organ prolapse. So these are really high numbers. So it's a really common problem. Men also have pelvic floor muscles, so a lot of men don't realise that, and we see a number of men who have bladder problems. We see quite a number who have had their prostate removed for prostate cancer, and pretty much all of these men have significant loss of bladder control afterwards. And we know that if we can get the pelvic floor muscles working better, then it can improve the severity of the bladder leakage and lessen it, and it also means that it doesn't last as long. So the other issue we see a lot of is fecal incontinence, and in New Zealand 1 in 8 people have problems with control of the bowel, so that's a really big problem as well. But all of these issues can be helped with pelvic floor muscle exercises, but unfortunately there's a real lack of awareness about this. It's not talked about. People don't know what they can do, and they don't know where to go for help. So hopefully by the time you've finished listening to this, you'll have a bit more of an idea about what you can do to help yourself. So I want to start with showing you the anatomy of the pelvic floor. So I've got my pelvis here. So this is the bony pelvis, this is the hip bone. So if you were going to put your hands on your hips, this is where they would be. You have your pubic bone at the front there. Around the back you have your tailbone, and then you have your sit bones here. So if you're sitting and you sort of wiggle from side to side a little bit, those are the bones that you would feel, or if you put your hands down there, that's what you'd feel. So if I tilt this over, this is clearly a female pelvis. So the muscles here, the pelvic floor muscles, this is the superficial layer. They line along the bones there. They wrap around the vagina. They go from the perineum, which is that skin between the vagina and the anus, and they go out to the sit bones there, and then you have your anal sphincter muscles at the back. So men have pretty similar muscles. We don't have a male model. They don't make one, so I can't show you a male model, so I'll just show you one here. So obviously men have a penis, so the penis is here, and instead of the muscles here that wrap around the vagina, they've got the same muscle, but it wraps around the base of the penis. They also have muscles that line along the bones here. They have muscles going from the perineum between the base of the penis and the anus, go out to the side, and they have the anal sphincter as well. So there's another layer, which is the deep layer. If you're looking from the front here and I tilt that over, you can see this layer inside. It's like a bowl. It wraps all the way around, and the muscles go through from front to back. They fan out, and then they split here and they come and attach onto the bone at the front. So in there, the bladder sits in there like that, and the rectum sits in the back. So that's what it would look like for men. For women, they also then have the vagina in the middle, with the uterus sitting over the top. So you can see how the pelvic floor kind of sits underneath and supports, and actually that's one of its main functions, is to actually hold the pelvic organs in the right place, and it's a really important role. Another function of the pelvic floor is to help with control of the bladder and the bowel. So a good functioning pelvic floor will help you to keep your urine in and help you to keep your fecal matter in until you're ready to go and ready to empty. So the muscles have to be strong enough to do that. They then need to be flexible enough to relax and let go so that when you're ready to empty, you can. So we expect a lot from them. They need to be strong, They need to be flexible, they need to be coordinated and relaxing at the right time when you do want to empty, but holding on the rest of the time when you don't want to. So waiting until you choose to go to the toilet. These muscles also have a role in sexual function, and they're also part of your core. So what we talk about as the core is the sort of muscles around the trunk that stabilize and hold you together around the trunk. So we talk about that as being like a cylinder of stability. So that involves your abdominal muscles and your back muscles at the back. So for a cylinder to be stable and respond to changes in pressure, so changes in intra-abdominal pressure, so protecting your back, it needs to have a floor and a roof. So the floor is the pelvic floor and the roof is the diaphragm, which is this horizontal sheet of muscle underneath your rib cage. So these muscles need to be working together in a coordinated way to provide that core stability function. So that's another really important role of the pelvic floor as being part of that. So how would you know if you had a pelvic floor problem? What sort of symptoms would you be presenting with? So one of them is wet pants. So this might be just a few drops when you cough or sneeze, and then there's a big range. It could be anything from that right through to complete loss of control and really wetting right through to your outerwear and perhaps even running down your legs. That might be happening when you cough or sneeze or jump or run. You can also have problems that indicate pelvic floor dysfunction. That other problems might be having to go to the toilet more often than normal or having to rush to get there. So you get a sense of urgency. So this could come on perhaps when you get home and you put the key in the door, suddenly you've got to rush off to the toilet, or it could come on when you're actually at the toilet and you don't quite get your clothes off in time to empty and you end up wetting a little bit. Other people sometimes get it with running water. Another symptom of pelvic floor dysfunction is prolapse. So the sorts of things that might indicate that you have a prolapse would be a dragging, heavy sensation. For women, it might be a bulging at the vaginal entrance or a sense of heaviness. Other symptoms of pelvic floor problems include having accidents from the bowel or losing control there, and also problems emptying the bowel. So there's lots of different things that can be affected if your pelvic floor muscles aren't working properly. So I just want to point out here too that not all pelvic floor problems are caused by weak, lengthened, stretched muscles. There are some people who have short, tight muscles. They're not necessarily strong, but the treatment is different, and that's not what I'm talking about today. So if you're getting symptoms like pain, genital pain, for women, problems putting in tampons or problems with sex, for men, erectile dysfunction associated with bladder problems or urgency and frequency, then I would suggest you talk to your GP and perhaps get referred to a specialist or to somebody who might be able to help you with that. But what we're talking about today is pelvic floor strengthening for the symptoms of pelvic floor weakness that I've already mentioned. So how do you do a pelvic floor muscle contraction? I'm going to teach you in sitting. So if you're sitting now, I want you to sit up straight, bottom back, upright, nice and relaxed. You need to have your inner thighs relaxed and you need to have your tummy relaxed. So the sensation of a pelvic floor contraction is as though you were squeezing and lifting up inside. So that sort of squeezing together and pulling up. The sorts of cues we might use for that would be stopping your flow of urine or trying to stop passing wind or stopping a fart. So I just want to say there too that it's okay to test stopping your flow of urine when you go to the toilet, and if you can stop it or you can slow it down, then that means that your pelvic floor muscles are working. However, we don't want you doing that as a way of strengthening the muscles. It's really important that when you're emptying your bladder, you don't stop and start the flow of urine all the time. But it's okay to do it occasionally as a test to see if you can or not, and then maybe do it a few weeks later if you've been doing some exercises to see if the muscles have got stronger. Another cue that I use with women is imagining that you're squeezing around a tampon and pulling it up. And with women, you should feel a sensation at the front, the middle, and the back. So you should feel a sensation around the vagina, and you should feel the perineum pulling up, and you should also feel the anus squeezing. So all of those should be happening when you do a pelvic floor muscle contraction. With men, you should be feeling like the testicles lift. You should feel as though the penis retracts and pulls up, and the sensation should be at the front and the back. So the anal sphincter will tighten, so you'll feel a tightening around the anus at the same time. Another cue that's been found useful, and this has been shown in research to be a good cue for men to use when they're thinking of how to get their muscles working, is nuts to guts. So think about that. That's a good one to activate the right muscles at the right time. You do need to be really careful when you're doing pelvic floor exercises that you isolate the muscles. So if you are using these muscles functionally in your daily life and daily activities, then all your muscles are kicking in and working together. That's not what I'm talking about. What we're talking about is pure strength exercises. So this is what you're doing when you're trying to improve the strength of the muscles. So when you do a pelvic floor contraction, you should feel that squeezing, and at the same time, you should also feel a little drawing in of your lower tummy muscles. So if you put your hands on your hips and then you just put your fingers in and down slightly on the tummy, when you tighten your pelvic floor, if you have a drawing in there on the lower tummy, then that's fine. But what we don't want is a sucking up under the ribs or a sucking up of the chest. We also don't want you squeezing your buttocks. So sometimes people, when they're having trouble working out how to do their pelvic floor exercises correctly, they end up doing a buttock squeeze, so your gluteal muscle squeeze. And if we see you doing that, lifting up on the chair, you're using your buttocks, not your pelvic floor there. The other thing that's really important is that you let go fully afterwards. So ideally, you should feel a contraction. You should be able to hold it for 10 seconds at a strong level, and you should also feel it relax afterwards. So if you can't hold it for 10 seconds, that's fine. If you can hold it for 1 second or 2 seconds, that's fine. You can do that. You start there and you can build up. So at least if you can do it, you've got something to work with and you can build up the strength. If you're having problems, if you're not sure if you're doing it right, or you're not sure if you're isolating the muscles correctly, then I would encourage you to seek help from somebody who's got specialised training in pelvic floor exercises and is able to check that you're doing it correctly. So we do see a lot of people for pelvic floor muscle training. Part of our treatment is the strengthening, but it's not the only thing. It's also really important that you're aware of the things that you're doing in your daily life that might be putting pressure onto the pelvic floor and causing stretching and other dysfunction there. So there's some simple things that you can be aware of. When you cough or sneeze, you should be conscious of trying to tighten your pelvic floor, because a cough causes quite a strong downward pressure, and that can cause leakage of urine, and it can also contribute to the formation of prolapse. So when you cough or sneeze, there should be a squeezing of your pelvic floor and a pulling in of your tummy, so you get that as you cough or sneeze, and that will offset that downward pressure. Another one is heavy lifting. So you need to be careful how much weight you lift and how often you're lifting. So this includes things like carrying in groceries from the car. We all are guilty of bringing in everything at once so that we only have to make one trip. But if your pelvic floor muscles aren't as good as they should be, make more trips or leave some of it there for somebody else to bring in. Paving things around in the garden, bags of compost or lawn mowers, that sort of thing. Pot plants, carrying out heavy baskets of washing to the washing line. That can also, be quite a strain and put quite a downward pressure on a weak pelvic floor and contribute to prolapse. So monitor that, and also be careful how you lift. So it's really important you keep your back straight when you lift, that you don't bend your back, because as you come up, then you're more likely to strain your back and also more likely to put downward pressure on your pelvic floor. And as you lift, you should be squeezing your pelvic floor and squeezing your abdominals. Another factor to consider is not to get constipated or strain on the toilet, because that also contributes to prolapse. So if you're having problems with constipation, sometimes you can just simply make sure you have a little bit more fluid or improve your diet and have a little bit more fibre. But if that's not enough to fix it, then please seek help. You could talk to somebody who's got extra training around this, or go to your GP or talk to your pharmacist. There's lots of options, and you need to be able to go and empty and not be straining so that you can protect your pelvic floor. The final one I want to talk about is obesity. So if you're overweight, there's more pressure, you're carrying more weight around. When you cough, there's more pressure downwards on your pelvic floor. Just moving around, it's just a bit more stressful. So it's a good idea to try and lose some weight. And actually, there are studies that have shown that with obese women, even a 5% loss of weight can improve your bladder control by 50%. So it's quite significant. So these factors are all really important things to consider when you're thinking about looking after your pelvic floor. The other thing is appropriate exercise. So by this I mean exercise that's suitable for your pelvic floor at that time. So for instance, if you've had a baby and your pelvic floor muscles have been stretched and they're weak, then you wouldn't want to be going back to perhaps doing high impact activity, running, until you've built up that strength again. Otherwise you're at risk of causing things like incontinence or prolapse. So it doesn't mean you can't ever do that again. It just means that you need to make sure that you get things strengthened up, get the muscles nice and strong, working in a functional way, so that you're not going to cause issues further down the track. Because you've got the rest of your life to do exercise, it's important just to be careful. Another time might be after surgery, where things are a little bit weak, and you want to make sure you strengthen things up before you return to exercise. So there's a number of other factors that also mean that you're at greater risk of pelvic floor dysfunction. So these are things like childbirth, age, menopause, pelvic surgery. So you can't do anything about those factors, but what you can do is make sure that you've got nice, strong pelvic floor muscles, that you're doing your exercises. So it's no use having strong muscles and not doing them, because then they'll just get weak again. And then you can offset some of these other risk factors by making sure that your pelvic floor is in good condition. And just remember, everybody should know how to do these exercises, and everybody should be doing them. So not just after you've had your baby, but forevermore, keeping them nice and strong. And it's never too late to learn. So even if it's years ago that you had your children, you can still learn how to do these exercises and how to get these muscles nice and strong. Don't accept pelvic floor problems as normal. So they are common, but it's not normal. Don't put up with it. You can do something about it. I think one of the reasons why people don't seek help is because there's shame and embarrassment associated with these problems. But please don't be embarrassed to come and see us. It's what we do. We're used to talking about these sensitive issues, and we know that you're not, and we never lose sight of the fact of that, and we will allow lots of time. We will do our best to help you feel at ease, and I want to reassure you that no question is a silly question, so you can come to us and talk about anything. So the sorts of people that can help you with bladder problems and prolapse problems would be pelvic health physiotherapists, pelvic floor physios, or continence nurses. So you could get in touch with Continence New Zealand, and they would be able to tell you who's available in your area. So thank you if you've got this far. I hope that some of the things that I've said will be helpful for you, and that you've got a little bit more of an idea about why you should do pelvic floor exercises, how to do them, how to seek help if you're not sure, and also the other things that you can do on a daily basis to help stop putting pressure on the pelvic floor and causing problems. So thank you very much. It's great.